Hello, everyone. Welcome to Facebook Live. My name is Cathy Madson. I'm a certified dog trainer with Preventive Vets, and I am joined today by the lovely Dr. Stephanie Austin, a fellow Preventive Vet team member and veterinarian. I'm so excited, Stephanie, to talk about this because I have been getting questions from clients already about 4th of July, and I think it's really important to actually start thinking about it earlier rather than like, it's July 3rd and what do I do? Because my dog is freaked out with fireworks. So we're going to talk today a lot about the medications that are available for noise anxiety. We'll also dive into things that we can start doing now to desensitize our dogs and cats to the booms and all the I don't love fireworks myself, so I might desensitize myself a little bit over the next month. And then kind of what to do on the day of, because I know some people go out for fireworks shows, especially this year, now that they're starting to happen again after COVID. I hunker down on 4th of July. What do you do?
To be honest, I work in an urgent care facility, so we're open 365 days a year. So there's a good chance I'm going to be working. So my puppies will be home alone, unfortunately. So I'm probably going to race home to them and hunker down. Yeah. I'd love to say I'm going to go out, but I'm probably one of those people. As much as I love fireworks, I don't love the crowds that come with them. So
yeah, definitely.
Probably going to watch them from my balcony.
Exactly. Yeah. I always just watch them on TV.
Yeah.
Stay in my house, close all the blinds, turn
exactly.
and watch TV. Yeah. That's what we do.
Exactly.
And then Fozzie Bear, my puppy, is joining us today. He's on the lap today.
Yeah, he's actually the main presenter, guys. So
yes, that's what we've decided.
Yeah.
But if you're watching, feel free, pop any questions you have or comments into the comment box. We'll answer those as we go. Yeah, you got that. And then if anyone is watching this after the live, you can still comment and we will come back and answer any questions you might have as well. So if you're watching after this is posted, please feel free to put those in comments as well, and we'll get to those. So I wanted to start with things we can do now in June to get ready. And I think it's important for people, especially those with dogs, especially they know that they have noise anxiety or noise phobia, to connect with their vet. And why is it so important to start talking to the vet now and talking about possible medications rather than waiting?
Yeah, so I mean, really good point. A couple of reasons. One of the biggest reasons is if we're going to need to do prescription medication, which we'll get to in a minute, but some prescription medications don't, and people who may have anxieties themselves may understand this as well. You can't just give them the medication and just it's a fix. It's a magic pill. It takes a little while for the medication to kick in, even up to weeks for that to start. And, we're already into June here. So July 4th is just around the corner. So if we're going to need something like a prescription medication, you can't give it on July 3rd and be like, hey, you're going to be fine for July 4th. So we need to start thinking about that. And also a lot of veterinarians and behaviorists like yourself, are not that big on just popping pills these days. So we like to try a bunch of other stuff first, because prescription medications certainly have their place, but there are a lot of other things that we can try first. So we might want to do that first. And also medication trials is a huge one as well. We're going to want to try things, see how your dog adjusts to them. Is it the right medication? Do we need to do another one? We'll have to try that one too. So again, you're not wanting to do this on July 3rd. So definitely start thinking about it now and get an appointment with your vet. Sorry if you are getting a view of my big boy here. He decides he needs to be involved. So he's making sure you guys get the recommendation to go and see your vet.
Yeah, and it's one of those things too with COVID and the new protocols that vets have to do. It can be really hard to get in for regular stuff. So if it's tough for them, is this something that the veterinary office can talk over the phone with them about if they've seen them recently for an exam, or do they have to have a hands-on exam to start this?
So it's a good question. Some vets will operate in different ways. If you have had an exam recently, certainly at our office, if you've had sort of an exam within the last month or so, and it's been a healthy exam and it's something you've discussed before, anxiety, certainly, can discuss medication. Like recently I've had a couple of conversations with people about anxiety and things to do. We can discuss prescribing medication or, okay, yes, we can try that calming treat or something else. Then sure, we can do that. If we've never seen you before, then absolutely you're going to need a physical exam first. So, you can even do things such as telehealth visits as well to discuss these types of things. But most veterinarians are going to want to rule out that it's not a medical condition first, because there are legalities behind what we do. We have licenses. We worked very hard to get our veterinary licenses up to, in some cases, like myself, 8 years of schooling to get where we are today. And I think some people forget that when they're really stressed out and worried about their pet. And they're like, just give me the meds and no one gets hurt. And I get that, but I worked very hard to get where I am today, and I just can't bank my veterinary license on someone that I just don't know. And I appreciate that you're worried about your pet, but I have to worry about my future too. License. Yeah, exactly. So just try and understand where we're coming from too.
Yeah. And you mentioned supplements, right? I think it's important for people to think about too, even if it's a supplement that you can just get at a pet store, especially if your dog or cat is on other medications or has medical issues, you do want to just connect with your vet to be like, I want to try this supplement. Will that be okay? Right?
Exactly. You should always connect with your vet first. I know marketing is great. Also, Amazon, love Amazon. Like, who doesn't? Who wish they hadn't bought shares in Amazon? I know personally, as an Amazon shopper, I'd be a millionaire by now. But I have a lot of people come in and they're like, yeah, I bought this supplement on Amazon. It's not working. You're like, yeah. Okay.
So many from like.
Exactly. Like, is it because it's made in China or, like nothing against that, but it just in terms of like, if you'd asked me first, I could have given you the right supplement to go and get from Amazon. Yeah. Because, we do recommend a lot of different products from Amazon that are great. But if just chat with me first, and a lot of veterinarians are more than willing to chat with you or email with you, or we have fantastic, it's certainly at my clinical practice, we have fantastic nurses that we have on staff that will provide this information to you, or they'll chat with us and then provide it to you. So, just reach out to us first and we will provide that information for you. You're not in this alone. We're willing to help, but you just have to ask. And just like people, you go to a doctor and it's like, oh, you want any medication? And they want to know everything from melatonin to sleep, to any vitamins that you take in the morning, because it really can be, any kind of mix up or anything that it may not, sit well with each other, and people just don't understand that. So just be really careful. Just reach out and be like, hey, doc, I'm going to put Sally on this, I was thinking about this chew. What do you think? And, I can even just forward it to my nurse and be like, hey, can you get back to Mr. Smith about this? Tell him that I actually really recommend this chew. And she is on, XYZ supplement. So this one would be better. And, my nurse can do that for me. Saves me time, saves Mr. Smith time. Make sure Sally doesn't get sick.
Yeah. That's great advice. So I popped in a link into the comments for everyone. And this is an article that you just recently wrote about the medications and supplements that you recommend, but especially the prescription medications that are commonly used for noise anxiety. Before we kind of dive into those prescription options, which what we're talking about here is what you should ask your veterinarian about for your dog when you do call them about what to do for 4th of July fireworks. I first want to talk about the signs of noise anxiety, noise aversion. You might hear it called noise phobia, fear of fireworks. There's like so many things we can call it in the dog behavior world. What we usually see is a dog who, when they hear loud noises or feel the vibrations of those noises, so it can be different senses all kind of wrapped into one, trigger the anxiety. But we see things like wanting to hide, right? Wanting to run away, that escapism. So you often see dogs or cats like hiding in the weirdest places that you're like, why are you under the bed in the guest room? Yeah. You never come in here otherwise. Or why are you in the bathtub? I had one client whose dog, that was their safe space. Wow. Which I was like, okay, that seems very counterintuitive. But if they feel safe, they're great.
Okay, yeah.
You see that wanting to hide. You sometimes see pacing, that restlessness, panting. It's kind of stress panting, and they can't settle. That's what my older girl, Suki, as she's gotten older, she's gotten more anxious when noises are going off. For fireworks and thunderstorms, but she just can't settle. She's pacing around. She seems more clingy, so you might see more clinginess to you. Lots of freezing, or ears back. They just look panicked or scared, right? So you kind of get that gut feeling of like, you don't like this, right? And it's they hear that noise, and a lot of times I'm always wondering from a behavior standpoint of, is it more because you don't know what's happening, you can't see it? Right? Or is it just the history of being startled and scared? Because it's normal for dogs, cats, us, all animals to be startled by something, especially a loud noise. We all, like a car backfires, and we're like, right? But it's the recovery time after that that's really important for noise anxiety. And for the dogs who get anxious and have a phobia, they just amp up. They can't settle and come back down and be like, okay, that startled me for a moment. No big deal. It's okay. Right. The anxious ones, they just can't come back down, and they start getting more restless. They start wanting to run. It's that flight instinct and get away from whatever it was. But it's hard to get away from a sound if you don't know where it's coming from, or it's everywhere sounding like fireworks are sometimes. So you want to watch for those signs. More subtle signs include things like yawning. So they're all the time, they're stress yawns. They're trying to calm themselves down when they do that. You can yawn at your dog and see if they yawn back. It's a really cool calming signal you can do. Or even vocalizing, barking, whining, howling when they hear that. All those indicate higher anxiety. And so for the people watching who have dogs with noise anxiety, you already know. You know that it's not going to be fun, right? So from the medical side, what are kind of the top prescription medications that you discuss with your patients coming in about what might be a good option?
Yeah, so that's a really good question. We do have a bunch of different medications that are prescription level, and it really depends on what you're looking for. If we've been through all the different other types of non-prescription medications, and we kind of categorize the medications into two categories. We have like the fast-acting short-term medications versus the longer-term medications, and basically we use them for the different situations. So the fast-acting short-term medications would be things for like situations. It really just depends on what you're looking for. So if you know your dog has a situation where it's up to it's a firework situation, or it's a thunder situation, or it's it's something like that sort of situation, versus it's a anxiety situation that it's a longer term issue, then we can use the short-term medications. So something like a medication called trazodone. Trazodone is something that's what we call a serotonin antagonist. So everyone knows, or I feel like everyone would know, serotonin. That's used as antidepressant a lot in people. Sorry, my big dog's decided he's trying to take my computer off the table. So trazodane's used a lot as like a really short-term medication for dogs that like may have separation anxiety, for people who are going out for an hour and coming back again, in an hour or 2 hours, something like that. It works really quickly. It works within 1 to 2 hours of administration. Basically, it's just calms them down, almost in a sedative type effect. And then we have something called Cilio, which is made by a company called Zoetis. Everyone really likes this one because it's a gel. So for dogs that aren't very good at taking tablets, so basically 99% of dogs, it's really good because you can just rub it on their gums. And again, works within sort of half an hour to an hour. Again, works pretty much immediately. And you basically just see them sort of calm down, same sort of thing. That active ingredient is something called dexmedetomidine, something we used a lot in, or still do use a lot in horses. So I really like that one. And they have the same gel in horses as well. And when I used to be a large animal practitioner, I used a lot in horses for traveling or doing dental work. So again, another really good one there. One I lean to a lot, surprisingly, in cats for traveling in dogs is something called gabapentin. That one was, still is, I guess, but not used as much. Actually, an anti-seizure medication in people, funnily enough. And it is an anti-seizure and pain medication for people, not really used that much anymore in people. But we use it a lot for pain medication in dogs. I'll use it after my routine spays and neuters. And I love its effect because it has that pain effect, but also has a sedative side effect or a drowsiness side effect. So I like it because it just takes that sort of edge off. It helps those dogs after a spay or a neuter just sleep and be drowsy, because typically we're spaying and neutering animals that are young. So they
very active.
They're pretty active. And so in cases where we're trying to, treat something like a noise phobia for fireworks, you just want to take the edge off, chill them out. You've got your blinds drawn, you've got the windows closed, you're trying to drown out the sound and also the edges off, and they can just take a nice little nap in the back room. So that's a good one there. And then diazepam, or also known as Valium, which is still used in people for seizures as well. And also in dogs, we'll use that pretty commonly for an active seizure activity in a dog or cat that comes in. So basically is an anticonvulsant and also a tranquilizer, muscle relaxant. We can use that as well. It's a little bit stronger medication used to dull the senses in animals. So really what we do is we almost grade the need for these medications, these short-term medications. And again, that's why pretty sure my dog's eating my plant right now. Yep, that just happened. This is what living with animals is like. So I hope you're watching. It's just appreciating.
You can call him over and he could be a part of it.
Yep, now he's doing my plant. Is this what living with toddlers is like? People who have children.
So, yeah.
One dog digging a hole in the wood floor and one dog eating a plant. So it's like,
I swear they wait until they're like, "Are you live on something?" Because
right? All morning, nothing. And now, because I can't do anything about it, I have two destructive toddlers. It's great. So
Cilio is the one that I've heard the most. Because it's newer. I don't think it's brand new. I feel like it's been out for a while, but
it's definitely newer of the short acting medication.
And I feel like I've heard about that the most, especially for people who have dogs who are like thunderstorm phobic and they are watching the weather and they're like, okay, like it's thunderstorm season. I have my Cilio ready and maybe it's going to happen this afternoon. So right before, hour or two before, I'm going to use the Cilio.
Yeah.
So I feel like that's been a lot more common for what my clients have had their veterinarians prescribed for that event specific stuff, not so much the broader anxiety. I feel like the short-term kind of medications are really what are focused on for the event stuff.
Exactly. And that's exactly what they are. It's like short term, they work for what they're needed for the hour or two, and then we're done. Flights, separation anxiety for that, hour or two you're out to dinner, thunderstorms, fireworks, and that's it. But they're not going to work for probably the cases you see that really have big issues, that really need.
Yeah, and that kind of generalized anxiety. What's interesting is noise anxiety is the most common anxiety diagnosed in dogs, but it has what we call comorbidities. So other anxieties that come along with it. If I have a separation anxiety case, a lot of them also have noise anxiety. And so a lot of times we see those combinations of anxiety. The brain is such a wonderful and weird place. You got to think so many things are connected. Right. Yeah. And all of that feeds into other things, or they're just chronically stressed because they feel anxious or fearful all the time. And then that triggers other issues. Right. Yeah. And so the chronic stress really can lead to a lot of anxiety. So for longer term medication. So if you have a dog or a cat like that has anxiety issues, and then you're like, oh, it gets so much worse when there's noise events like fireworks, what kind of medications should someone ask their vet about for kind of that longer term?
Yeah, so that's a good question. The longer term medications are surprisingly medications that are prescribed for humans, and the same medications for dogs and cats, but are the Prozacs and the Xanaxes. And just a warning here, and it's actually something that came up this week or last week in my practice, but absolutely under no circumstances give your own medications to your pets. I actually had to have, and I'm not an arguer. I'm not someone that gets heated really with my clients at all. But, I had a client who should not be named, of course, that was like, well, I'm on those medications. I'm just going to give my dog my medications because unfortunately with animal medications, you can't get them on, prescription, or obviously on prescription, but you can't get them on, your insurance card or whatever. So they're more expensive, which, is something I wish we could help with. And so this gentleman said, well, I'm just going to give my medications to my dog. And I was like, please don't do that. Whatever it was. And he's like, well, why not? Like, it's going to be the same dosing. It's going to be whatever. And I had to explain to him how, the metabolism is different. And, if you give your dose, it could be very different, or I'll just figure it out, like based on my dog's body weight and whatever. And it was just such an awful conversation for me to have, trying to explain to him that you could overdose your dog, you could kill your dog. Yes, they're the same medication, but it's so different. And please just let me do my job and let me script the right medications for your dog.
Timing of doses, like all of that goes into it, because you're right.
Yeah.
Metabolism's different. It's
like you give them, how much you give them, the timing of it. It's all so different. Like, great, it has the same name, and yes, it's the same product. But just because, you're on Xanax, and I'm going to put Freddie on Xanax, it doesn't mean that you guys can, have your morning coffee and your Xanax together. So, just please be aware that, and maybe it's a funny joke that you and Freddie are taking Xanax, but it's just so not the same. So just really be aware of that. But to go back, it is Prozac and Xanax. So fluoxetine is Prozac and alprazolam is Xanax. And both of them are long-term medications. Fluoxetine, I don't necessarily prescribe as much. The reason being is that it does take a long time to get into the system. So you do need a few weeks for it to actually get on board. And I find that owners usually are desperate at this point when they're coming to you. They're pretty desperate, and they're pretty worried, and they're like, it's not working. And like, I know, because it's only been like 3 days.
And it takes time to build up in the system, right? So that
it takes like 3 weeks or so. And then the other problem with it is if owners aren't, if they're stressed, they're not listening to you, if they stop it suddenly, you can get withdrawal. And you have a lot of problems with patients just suddenly stopping fluoxetine if owners don't get the prescription in time and refill it, etc. So I don't love it. It's a really difficult drug with owner compliance. So I just prefer to script drugs that are just a little bit easier to use. So alprazolam is one. You don't need to have it in the system for weeks. And it will work sort of within 30 to 60 minutes. And you can stop it tomorrow and you won't have any side effects. So, but it also can be given long-term versus the short-term drugs that we were talking about. It's not that you can't give them long-term. It's more just like sedating your dog long-term. It's just like really just taking away their personality. You're like, here, let me just keep you sedated long-term. Like kind of what's the point? Whereas alprazolam, it's just like a person going on anti-anxiety medications. You're really just modifying the serotonin and all of the different receptors in the brain to sort of behave the appropriate way.
Feel better about.
To feel better, exactly.
Well, yeah, and I think what's important too is sometimes I have cases, and I understand when my clients are like, I don't want to do prescription meds. And when it comes to things like anxiety or fears, things like that, if their dog is at such a high level of anxiety, any kind of behavior modification, which we'll talk about, desensitization, counter conditioning, especially for noise anxieties, all of that work you put in, one, it can take a lot longer for the dog to actually, like, for it to stick, right? Because their brain is just so stressed that they can't learn those new things. They can't make the new connections that you're trying to do. And so bringing prescriptions on board can be really helpful for a lot of kids. And a lot of times I'm like, let's just start them sooner rather than waiting, rather than trying to put on this work now just to come to the same conclusion later. So they can be really helpful earlier. But then there's sometimes too where it's like, well, let's try all the other behavior modification stuff, because really the only treatment for anxieties is behavior modification. But the prescriptions can help you get there. They're so helpful. So noise anxiety, you've talked about kind of short-term options to talk to us about, the longer-term stuff. But if you have a dog or a cat who suffers from general anxiety, noise anxiety all the time, right? All those things. It's so important. Connect with your veterinarian, connect with a veterinary behaviorist as well. There's not enough of them out there, so it's hard to get in, but they're so worth it because they can really help combine the behavior modification in with any prescriptions. And then long term, they'll be able to talk to you about, is this something we need to keep your dog or cat on long term, or is it something we start to wean off? We're doing better and better. So connecting with a vet is so important. But especially now, before 4th of July, weeks before. Don't wait till July 3rd.
Yeah, exactly. That is the most important.
Yeah. So last thing on this one, what supplements do you like the most for noise and things? And I guess before you even jump into that, I'll mention CBD because I'm not a vet, so I am allowed to talk about it. Where there's lots of cool studies going on with CBD right now. It's awesome because I'd love to see where we can use it more with our pets. But veterinarians are in a tough position in how much they can really talk to their clients about it because of legal things in the country. But for noise anxiety in particular, I've been kind of watching the studies coming out for this. There's a lot of anecdotal stuff on the internet where people are like, oh, just try CBD oils. Go to the pet store. They'll show you the brand they have and help you with doses. It's not really regulated well. So you do want to make sure if you are going to try CBD that you get it from a source that you've researched, really looked into, good ingredients tested. Elevet is one that I recommend checking out if you're interested in CBD for your pet. But there was a more recent study that for noise anxiety in particular, CBD didn't really show a lot of efficacy in helping. So just keep that in mind. It might be a good calming thing for your dog, but again, do your research. Do let your vet know that you're going to be adding that in, right? Make sure that they at least know and see what they're willing to share with you as far as what they think about that. But do your research on CBD. But it's not usually my first choice on something to kind of add in as a supplement for noise anxieties. I tend to go more with the other supplements that we'll talk about, and then on the non-drug options that we'll also talk about in a second here too. But what supplements do you tend to recommend to your clients?
Good question. So there are a couple of different ones. I mean, there's so many out there, let's be honest. We could probably have a whole different Facebook Live event on this. So it really depends on like what you think works. So I really like the calming pheromones. Again, I feel like 50% of people are going to say it doesn't work. 50% of people are going to say it does work. For my cat, at least, I found that the Feel Away diffuser and things like that really helped her, and not necessarily for noise phobias, but because it helped her with some issues that she had as a younger kitten. And when I would travel, I certainly, liked it. So then I figured, well, hey, why not use their other option for my dog, my older dog, which is the Adaptil. And, again, whether it works, I'm not sure. But, hey, these things are worth, a try. And then, I recommend it to clients and I had good feedback on it. So, if I get good feedback on something, I'm going to continue to do it. So I hear good things. I can only go back with what I'm hearing. So I really like the Adaptil and Feel Away products. So they're one that I'll use. I like the fact that they're pheromones. So for people who don't know what that means, pheromones are the natural hormones that animals produce. They're natural calming pheromones. So a mother will release these to their puppies or their kittens as a calming type sense, to be like, okay, it's okay, everything's fine, we're okay, you're fine. I feel like that's a really nice sort of way of being, I guess. So to sort of reassure them that everything's okay. So I really like that. The other one I really like is the VetriScience Composure Calming Chews. I've had a lot of foster dogs in my time. I'm up to, I think, number 18, which is the one I finally failed on. So I always have a bag with me because I have all kinds of fosters, from the crazy to the, I'm just going to sit in the corner and shake. I had one foster that didn't urinate for 4 days. I thought there was something wrong there, but it was just that was her way of being anxious. So, that's just their way of acting. So I always have a bag of Composure Chews. And again, some people don't think it works. Some people do. And that's by VetriScience. And I use a lot of VetriScience products in my clinic they have a lot of different product lines, from lysine supplements, et cetera. So I like them all. So that's one I really love. The new one that I've heard is the Soliquin calming treats for dogs. Actually had someone tell me that their dog had just started it yesterday. And again, lots of good positive feedback as well. And I think we have these all linked in the article as well. So if you guys need to find them, the article that Cathy linked just down below in the comments, they're all in there. So these are all really, really great, well-researched products. I won't use anything that I don't feel doesn't have good scientific research behind it. And again, I won't use anything that I wouldn't use on my own pets as well. So it's got to have good scientific research. It's got to have good backing. It's got to have good. My dog's going to chew up a box. No, you don't. And so they really do have to have a reason why they made this thing. No, you don't. Really apologize for this, guys. And then I think the final one we had recommended, or there's a couple. I think there's a couple more. The Calmies tablets. Stop.
Yeah. He's like, I want to chew up the box, Mom.
I know. He's like, you are not paying attention to me. Stop chewing up the box. I
think you should be a part of the live.
I know. I think you should. Gravy, come here. Come on. Come here.
Where's your face?
Come on. Everyone wants to see your face.
Now that you want.
Now he's like, now I don't. No one wants to see my face.
Yeah, I didn't know about the Calmies ones until you told me about them.
Yeah. So the Calmies tablets, I've had a really, really good feedback from clients recommending that. And I actually found that out from another colleague of mine because, a couple of, or a client had been through all the other products that I'd recommended and, it just hadn't worked for them. And so they're like, go try the Calmies. Yeah. Amazing. Yeah. So, and then things like the Thunder shirt, which maybe you can speak more on. I don't know if it's something you recommend.
It is. It's interesting because it's like, okay, this could work for your dog, but it might not work. And that's kind of the thing with supplements and non-drug options, noise anxieties, is it might work for your dog. Things like the Adaptil, I love the Adaptil, but some dogs I don't see any difference for, right? But it's not doing any harm. So let's try
exactly.
it. Right?
That's how I feel.
Yeah, and same with the Thunder shirt. The Thunder shirt actually has some great studies behind it specifically for noise anxiety, because that's what it was originally created for. It's starting to be used with other anxieties as well, but we're looking for more data of actually how effective is it for other anxieties.
Yeah,
it depends on the dog, but there are some good results, especially for noise anxiety, and it's not just Thunder shirts too. So there's the Thunder shirt brand that's pretty easy to find. It'll be in I'm going to link another article here, but it's in that. But there's things like Tellington T-Touch wraps. So there's different ways of using pressure points and wrapping, like large vet wrap around a dog. There's other kinds of wearables for anti-anxiety products out there too. So it's not just the Thunder shirt, but that's probably the most well-known. Yeah. But that's kind of just using that pressure, that calming pressure, like weighted blankets for us. I always feel smothered under those, but it's the same idea. It's like swaddling a baby too, right?
Exactly. Swaddling a baby, or those weighted blankets. Like that's the idea.
Yeah. And so it's kind of helping calm the system down, the nervous system down to relieve anxiety. So they definitely can work. They're worth trying, especially if your dog gets incredibly anxious in certain situations. But with all of those things, it's very similar to when prescription meds, you want to trial these things. Supplements, you can start trialing them sooner than when you actually know I will need them for sure on this day to see, do you notice a difference in your dog? Are they acting weird and maybe you don't like any side effects that they might be doing? Same with the Thunder shirt, same with Adaptil. You can just test these out, trial them as well so that you get a good idea of what does work for your dog, because every dog and cat is an individual. They make Thunder shirts for cats, which I think is just hilarious. Like
sweaters for cats is just hilarious.
This is funny. But you want to trial them out and see what works best for your dog, right? In that situation, because then you can really tailor it to what they need as you go. And that kind of brings me into the other prep outside of talking to your vet about prescriptions if your dog needs it or your cat needs it. Possible supplements and like the non-drug options of anxiety wearables and things like that. Speaking of that Adaptil and the Feel Away, you want to start preparing a safe space for your dog or your cat, especially for the event of 4th of July. And I like doing this sooner rather than later because you want to introduce them to their safe space before they actually need to use it. And they're like, what is this?
Yes, exactly.
So I love putting Adaptil in the safe space area. Adaptil also makes collars and travel spray. So there's a couple different options if you don't want to do the diffuser. You shouldn't be able to smell it yourself, by the way. So if you are using a diffuser, it's a dog or a cat pheromone, so you should not smell it because we're not dogs or cats, which I think is actually really cool. I need a human one is what I need.
Yes, me too.
Yeah, so I like creating a safe space. I'm going to pop a link into the comments here on how to set up a safe space. And you want to do this sooner and introduce it to them. Think of it as your dog's room where it's nice and calm, right? And there's comforting things there. So bedding, possibly a shirt that smells like you, right? Something calming, some nice chew toys that they love. This is where they get their work to eat puzzles because licking and chewing, very soothing activities for dogs to do, that repetitive motion. So like topples, the West Paw topple, my dog loves. There's like 5 on the floor way over there. Otherwise I would grab it. But that licking, repetitive licking, nice self-soothing activity for anxious dogs, or hyper dogs, right? So having a safe space and introducing it with, this is where you get your chew and you just get to relax and feel safe. Somewhere not close to the windows, especially on 4th of July, where they can see flashes of light or hear the booms even more loudly if they're right by a door or a window. You want it to have it more enclosed, and you want to just have it be really just soothing for them. So setting that up now, introducing them to that now is really, really important so that they know, I have somewhere to run to, right? And hunker down at. It's always a good option. One of my clients, it's in her closet. She set up a little dog corner in her closet where her dog was already naturally kind of going there when they were anxious. So we're like, well, let's make it their little room, right? And make it a little bit more calming for them if we can. Thinking about creating that safe space. And it's the same for cats, right? Where cats might want to run and hide. Let's create an environment where maybe that's even more soothing for them. So they can go there to escape. My dog's safe space is in the bedroom up here. It's like this office corner, and then their crates over here. And now they both fit in the same crate. It's really funny. I'm like, you don't both fit in there, but okay. But I like to have like a blanket over the crate. Yeah. I did this during a thunderstorm not so long ago. Blanket over the crate, kind of blocked out some of the noise. I closed all the blinds. I turned on music. So using music as a noise masker, especially on 4th of July. 4th of July, I actually tend to turn on like a really loud movie. It's a really good idea. Turn up the volume really loud. My neighbors are probably like, we hate it. But it's masking out the loud booms that are kind of startling for the dogs and me. So we kind of just hunker down on the couch together, right? That kind of tends to be the 4th of July safe space. So planning ahead for that now, thinking about where can we hunker down at? How can I make it more soothing using some of those other adaptive diffusers or feel-away diffusers as you go? Yeah. I think that's important to kind of do for them. I did want to talk a little bit about desensitization because it's something that people should start now as well, instead of waiting to 4th of July. And this is where you actually start getting into how do I prevent noise anxiety or fireworks fear from developing? And this is all about acclimating our pets to the sounds of fireworks or thunderstorms. You can do this with any kind of noise. And I really love YouTube has a bunch of options. Like you go on YouTube and you're like fireworks noises for dogs. And there's like hours of videos on there. And you play that at a very low volume, right? Very, very low, where it's almost like you don't really notice it. You don't want your dog to go, what's that? Every time that they hear a boom on the recording. You want it to be low enough that they're like, okay, I can handle that. Whatever, we're going about life. Oh, maybe treats fall on the floor. I get to work on a chew, or it's mealtime, or we're going to play tug while there's fireworks playing in the background. You're just habituating them to hearing that kind of noise, right? If they ever notice it, they go, what was that? Good boy, treat party. Right? Or let's play tug some more. So you're associating the noise that could be possibly scary or startling with, oh, that's no big deal. I've heard that before. It's good. You're good. Right? So that recovery happens really easily. And then as you practice this 5-10 minutes at a time, a couple times a day, or even just once a day, a couple times a week, you start increasing the volume incrementally. So in little small steps as you go. So it gets a little bit more noticeable, but they're starting to just get used to, oh, it could be really loud, but I've heard that before, right? So it's desensitizing that sound. And I'm going to share, just so everyone has it too, there's a great little handout that we created. And it's in a Facebook post we did, but you can look at this photo and it's a handout of how to do that desensitization, right? How to start really low volume, how to slowly increase it. If you ever notice your dog showing stress signs of like, oh, that one was really loud. Oh, I'm not so sure. I'm going to stop chewing or I'm going to stop eating and start to get a little anxious. What do you do then? You go back, you go way down lower volume, you restart, right? So you don't want to just push it too far, too fast. That can do what we call sensitize your dog, where you actually create a reaction to the noise. So you do really want to go in small steps. And that really is focused a lot on the dogs who, like Fozzie Bear, my younger boy. We've done that since I got him last August. Randomly, we'll play some fireworks noises on my computer while I'm working. Low volume to just get him used to it. It's more about that prevention of noise anxiety from starting. For the dogs, though, that are already anxious when they hear loud noises and those booms, and they just go and they panic. They go into panic mode. One, we want to focus a lot on counter conditioning. So what this means is they already have a negative emotional response, a negative association with hearing that thing, right? So there's already anxiety and fear as a response to that trigger, that stimuli that they're hearing. Mm-hmm. So we have to work on changing it, right? And this can take time, but what we do is we start lower volume of fireworks and a boom goes off and it's treats fall from the sky, chicken happens. Ooh, mom or dad gets really like happy. Yeah, good job. That's great. We're starting to change the association of, oh, that boom actually means chicken. Chicken's great. I love chicken. And we want to start at a tolerable level for them, right? We don't want to start with a really loud boom when we're starting this, because their brain will be so anxious already that they won't even want chicken. They're what we call over threshold at that point. So they're not going to learn anything. So we want that really low volume of boom, party, treat party. So you can do this before 4th of July and just start counter conditioning, right? And reach out to me if you have questions about this. You can always email me at training@preventivevet.com or comment here, and I can just give you some pointers on how to start it with your dog. But then the articles that we're sharing today have a lot of information too, how to do this. But it's also something that you should do on the day of 4th of July. Have your bag of chicken or keep some jars around the house by your safe space, and a boom goes off and you go, yes! And you run over to the treat jar and you throw some chicken on the ground. Right? Every time. And usually the dogs start going, when's the next boom happening? Because I want some chicken. Right? Or you see them hear a boom and then look at you like, chicken? And that's that positive response that we want to see to help them feel better about it and learn how to cope when they're hearing something that usually scares them up to death, right? And they want to run. So that's desensitization and counter conditioning. Right? One's habituation, getting used to it. The other one is creating really positive associations with the booms, rather than just kind of teaching them this is no big deal, right? And if you have any questions about that, feel free to pop them in the chat. It can feel complicated when we're talking DSCC, as trainers and consultants call it. So feel free to ask questions about that for your dogs in the comments. One other question for you, Stephanie.
Yes.
Microchipping. So we always recommend make sure your dog or cat is microchipped, right? Because 4th of July, I feel like there's an increase in lost dogs and cats over that weekend because of the flu response. But how easy is it to get into a vet to get your dog or cat microchipped if they're not already right now?
So, I mean, ultimately, again, I can only speak for my practice. We can have a nurse microchip, a dog or a cat. So it really shouldn't be that hard. We have nurse appointments available because we have licensed veterinary nurses or veterinary technicians essentially do it. It is, we always warn owners it's a bigger needle, but to be honest, I haven't noticed a dog or even a cat at this point notice. So I would recommend doing it if they are not microchipped. One of the biggest things to make sure of if you have a microchipped pet already is your information up to date.
Yes.
You will be surprised how many people move and forget to update their information, including their phone number, which is super surprising because we will call and their number is disconnected or it's someone else's phone number. And they're like, I don't own a dog. And you're like, cool. Yeah. Well, you do now.
You have one under your number. Yeah. That's so important.
So a microchip is pointless if you're not going to update your information. So if you're going to redirect your mail, absolutely update your microchip.
Yeah. Most of them you can update online.
Yeah.
Them. And some, I know some of my clients are like, I have no idea. I rescued this dog or like got it from friend of family or something like that. I don't know if it's microchipped. You can go and get them scanned to see if there's a microchip, find out kind of what company it's from. There's a lot of information that you can find out just from the scan.
Yeah.
And then go about registering it. And I'll throw a link in the comments here too about how to make sure your microchip is up to date. If you're not sure how to check, how to go about that, because it is so important on 4th of July. They have that instinct to run, fight or flight. You can't fight noise. So usually the flight one. And if they take off and get away from you, then you want to be able to have at least one way that people can get them back and help reunite you faster as you go.
Exactly. And, that being said, if you do find a pet, take it to your nearest veterinarian, ask them to scan it for a microchip, so that you can try and reunite it with its rightful owner. I know that pets are cute, but try not to keep it because if an owner is looking for it, or try not to keep it for a day or two because if an owner is looking for it and it hasn't been scanned and, the microchip company notified, then they're not going to know where that pet is. So make sure that you do get that microchip scanned so someone knows where it is. The other good thing as well, which I think, Cathy, you may, we're going to mention that, or maybe later on, is make sure their collar is on as well. If you don't have, with its tags, because if you don't know this already, their rabies tag is an individual number. So every time they are given a rabies vaccine, they get an individual number on that tag. So that tag is identifying not only the clinic that vaccinated it. So have a look at your tags, guys. If your dogs are around you, it'll say the clinic that vaccinated your dog, and it has a number. It's usually a 3-digit number, typically. So worst comes to worst, the next best thing to a microchip, if you don't have even a name tag and a phone number on there, if they have a rabies tag, you can say, oh, Max was rabies vaccinated at, Stephanie's vet clinic in New York City. Yeah. So let's call Stephanie's vet clinic with rabies tag number 098, and let's find out who this pet is, and we can search by the rabies tag number. So even that's
one more layer.
One more layer to it.
To find this dog or cat's home to get them back with their
exactly. So it's one more layer. So again, if you find a pet, guys, don't hoard it for the night, unless of course it's late. And if you do, please provide it some fresh water, a little bit of food, and a bed, and then take it to your local veterinary clinic in the morning.
Yeah, great points. The other thing that I like to do prep-wise before 4th of July, and then we're going to just quickly talk about day of stuff, because especially I saw Mary's question is a very good question about day of stuff, is kind of related to the preventing your dog from running away on 4th of July, is doing a perimeter check on your yard if you have a yard. So walking around looking for, are there places on the fence line that maybe I need to fill up, right? Or put a block, something to prevent them from going under the fence there. Are all the latches on my gates working and secure? And even in the home as well, especially for cats, right? Make sure that all of your windows and doors are in working order so that on 4th of July, when you hunker down, you can go through, shut all your windows, make sure all the doorways are closed so that there is no escape route, because you don't want that trauma of your dog or cat bolting out in fear and getting lost on the 4th of July, because they're just responding instinctually to that kind of stuff. So do a perimeter check, right? Fix that stuff up, make sure that it's secure. And then day of, usually what I do is I take my dogs out on leash for their potty breaks, when normally I don't. They're just wearing their collar while they go out on the patio and go potty. But on 4th of July,
one wanted up, scratching at my ankles.
On 4th of July, though, they are on a leash on my patio, right? Because I just don't want them to bolt. I just want to have another way of keeping them secure and with me. And they're a little bit more connected to me that way too, which I think helps with their anxiety, because they're like, Mom's here. It's all good, right? So that kind of has to do with the perimeter check. But then the day of, potty breaks, leashed. Cats are different because their litter box is usually inside. So you don't need to put them on leash for that. I don't think, as you go.
But, hey, I ran past someone that had their cat outside in a park on the Upper West Side the other day. And hey, you do you.
Whatever works. As long as you're happy, that's what I think.
I live in New York City. I can't comment.
So Other things I do on the day of, I exercise my dogs early, so before fireworks start going off. I increase enrichment, so lots of chews, puzzles, sniffing games on snuffle mats, things to just burn some of that energy, take the edge off, tire them out is really what I'm trying to do earlier in the day. And then I also save some really high value enrichment stuff like stuffed topples, stuffed Kongs for more of that evening time, fireworks time when those start going. Again, going back to the counter conditioning, I do hear a firework. You notice the firework, chicken, right? Cheese, something amazing happens whenever you hear that. So be prepared for that. Like have your little treat bag on all day, right? Or have your little treat jars kind of set around so that you can respond with real-time counter conditioning as you're going. I do noise masking. I turn on, like I said, I turn on a movie really loud, or I turn on music. Or like a white noise machine can also do really well, especially if your dog is hanging out in a different room in their safe space. Turning on a noise machine or just some music in that room so that you're helping block out the loud, startling noise as you go. And this kind of goes to Mary's question. So Mary was asking, is there anything the human should not do when our dog is experiencing fireworks fear? So there's this ongoing advice for some reason on the internet and in the dog training world where don't comfort your dog when they're showing fear. That's so outdated. You can comfort your dog if they're scared, right? You want to be providing them comfort, and physical touch can be comforting for them. Soothing praise, you're such a good boy, it's all good. It's all good, right? But where I like to have my clients focus is you're comforting and you're not coddling. Because if you start going, it's okay, it's fine, we're all fine, that's a different kind of energy than the, you're good. Was that a loud boom? Let's go get some chicken, right? You don't want them to feed off any anxiety you might be feeling by making them go, you're worried, I should be more worried. What are we worried about? And then they just amp up even more. So just be aware of your energy on that, where comfort, don't coddle. So don't get into that mindset with them. And it can be hard sometimes because we see our pets in distress. And so we're getting anxious about that. And what can I do? I can't control my neighbor who's putting off like 20 fireworks a second. And so it can be tough on us, but just focus on the loud boom chicken. You want to sit on my lap and I'll give you a massage. What a good boy. It's okay. Right. So kind of having that awareness of your own energy so that you're not transferring any anxiety to your dog. They mirror our emotions. They can smell the chemical changes of our own hormones and stress chemicals, all that fun stuff. So they know what we're feeling. So comfort, don't coddle. Beyond that, I mean, it really is, your dog more than anyone. So if you know that they just want to hide and don't want to be pet, so if they're giving you the vibes of like, nope, I'm in the closet, don't come near me, right? Doing that, don't force it. Let them stay in their safe space. You can still praise ever intermittently, or if they hear a boom, toss some chicken over to them, see if they'll eat it. Sometimes when dogs are too stressed, they will not take food. If they're over threshold. So that also gives you a good idea of their stress levels. Chicken in front of my face. Nope. I'm too worried. I'm not going to eat it. That's their nervous system is shutting down their want to eat because they're getting ready for fight or flight, right? So I don't need to eat right now. I'm worried about other things. So that can tell you a lot about their state of mind, but try to create a hopefully soothing environment for them. Still give them the praise and support as you can. Just don't get as anxious as they are as you mirror it. That's what I'd suggest as far as what not to do. Don't coddle, but still comfort, right? They deserve that from us. Those are my day of. Do you have any other day of tips, Stephanie?
No, I think they're really good ones. I think I'm a really big proponent, and this is probably just from the foster dog perspective, is exercise, and also because I'm a runner and I like to run with my dogs, is exercise is just such a big one. So tiring them out. just like us, it's so hard to be reactive when you're so tired. So, either a big play at the dog park if you're not a runner like me and can't be bothered to wear yourself out. A big play. And I say after getting up at 6 a.m. to go for a run this morning. Yeah, totally crazy. Trust me. Big play at the dog park, whatever you need to do. So the less energy they have to be reactive, the less they're going to be reactive. Whereas if you've sat around all day doing nothing and they have all this built up energy and tension, of course they're going to be more reactive. So yeah, I think that'd be my number one tip. And then obviously your tips on how to desensitize are, I've already written them down for myself. I'm like,
you have the outline.
Yeah, basically.
I'm going to add on something to the exercise thing. There are some dogs who over exercising actually makes them more overstimulated.
Agreed.
So know your dog and know that don't over exhaust them, because there are some dogs who I'm like, did you walk them today? They're like, we went on a 20-mile hike and this is them now. And I'm like, oh yeah.
They're quite literally bouncing off the walls.
Yeah. And it's almost too much.
Exactly. So know your dog, know their limitations. Whereas like the big fluffy thing, he goes for an hour in the dog park and he comes back and he barely gets in the door and he's like fast asleep. I'm like, yes.
Now I can work. Yeah. So you want to know kind of your dog's limits, what a good amount of exercise is. Do that earlier on 4th of July.
Exactly.
To avoid being out and about. If there's anyone I used to live in a rural area where fireworks would be going like 3 days ahead of time and then 3 days afterwards, and very random. So it was really hard. But really leashed walks, like making sure that there's some safety so that you don't get scared and run away. So I'll dive into some of the questions sent in ahead of time. And then Mark had a question. Let's see here. So he says, one of our dogs reacts the same way when hearing a car backfire as she does with fireworks and completely shuts down going over threshold. So she won't eat treats to desensitize her. Yeah. And this is tough too, because it's a sound that you don't know when it's going to happen when you're out and about, especially, or even in your house. Like now I live by a highway, so sometimes it happens. And so when you don't know when it's coming, it's really hard to desensitize to. But what you can do is I love YouTube. Also, our Pup Standing app, we have a free app that you can download, and it has audio clips in it. So shorter clips than YouTube, which might be more effective for something like a car backfire. And I'll throw the link in the comments here, is you start low volume of that. You play it once, right? Very low volume. You want a volume where she hears it but doesn't go, right? Where it's like, okay, well, what was that? And then you're actually going to be counter conditioning with that. Where you hear that, an ear turns. Mark has cardigan corgis, so the ear will turn. And chicken, right? And you repeat. And then you go up in volume a little bit. So I'd actually focus more on counter conditioning than just desensitization. There's overlap here of desensitization and counter conditioning too. So you just want to find a way of how can I control this sound at a volume that's doable and under threshold where she will take treats, and then slowly build it up over time. That doesn't necessarily mean that next time she hears a car backfire when you're on a walk that she won't startle, but hopefully we've created a response in the brain that if we go, yes, when we hear that car backfire and we go, treat, then she recovers really quickly, where it's like, oh, right, okay, I've done this. My brain knows what to do now instead of going down that anxiety pathway in response. I've practiced this where something startles me and then something good happens and I go, whew, deep breath. And then we keep going on the walk. So it'll take kind of both desensitization, but mostly counter conditioning for that. And then just being prepared. And I know Mark and Mary well, so I know that they're always prepared with some yummy treats to take advantage of that real-time counter conditioning and helping the dog cope again, right? And if they do go over threshold, that's okay. It's just kind of starting to do the comfort. Don't coddle, but you can definitely comfort them of, it's okay. It's okay. We're going to stand here for a second. I'm going to wait till you can take a few deep breaths. Maybe I scatter some treats in the grass for you to start sniffing out when you're ready. That can help lower heart rate, the sniffing, so decompression a little bit. So you can definitely comfort them, kind of help them through that as you go. But it's tough. Car backfirings, I mean, they startle me. But I actually think that was a car backfiring. And I'm sure the dog is just like, that was a really loud noise. I don't know what it was. Right? They can't reason, as far as we know, what it was. So I'd combine those two, Mark. I'd do some counter conditioning as well as some desensitization if you can. But by finding like a recording for it as you go. Other questions that we had sent in ahead of time. So one that got me thinking was from Bit, who wrote in and asked, what if you had a pup that was friendly, who then got scared of fireworks, and then now is anxious and not sure of other people? So this is what we call generalization of anxiety. And it's that single traumatic event for the dog causes them to be on edge in other situations. So instead of just in that context, it's now, well, could it happen now? I'm more generally anxious. Could it happen now? Right. So it's putting them on edge more all the time. And that kind of goes back to that comorbidity I mentioned earlier in the live of usually noise anxiety comes along with other things, other kinds of anxieties or fears. What's interesting too, is I was thinking about this. I was like, what we can't know as humans, because we're not in the dog's brain, is when they hear that loud, scary boom of a firework, what are they associating that with? So yeah, the loud noise, scary, but were they around people? Were they in a crowd? Were they looking at a child across the street? And then they make the association of that thing predicts loud, scary things happening to me. So they kind of create an association with something that we don't necessarily see as associated with fireworks. And so that creates the anxiety with that particular stimulus trigger, right? Rather than the thing that we think it was, or it's only fireworks. No, it's fireworks, and they globbed onto seeing that person in a hat. random example.
That makes sense. Makes total sense.
Well, and if we can't know like what exactly they're associating it with, right? So it's tough because we might end up with things we didn't realize were happening. So what I would do, I would do desensitization counter conditioning, but I would also do counter conditioning for other people, being in proximity of other people without fireworks. I want that to predict amazing things for the dog, right? So you're working that, changing the emotional response to different triggers that perhaps were created as negative in their brain together, but we're separating them apart so that it's easier for the dog to handle. And really starting at low intensity. So this is where, like with fireworks, low volume, right? Low intensity. But with people, it tends to be more distance from them. So further away is less scary for an anxious dog who's anxious around people. If there's more distance, it's less intense for them. So that's where you start counter conditioning. Oh, you see the people, good things are happening to you all the time. If you look at the person and then you look back at me, oh, something good happens to you, amazing. And then over time, you start working a little closer as long as they're comfortable. Same counter conditioning protocol there. Another thing to be aware of is the length of time that a dog is around people, because you might be very far away and working, but the longer you're there, the more anxious a dog might be feeling, because it's just stacking. They're like, I'm still here and I'm still kind of worried about that thing. It's like spiders. Like if I saw a spider, this happened to my best friend. She was taking a shower in like the Dominican Republic, and there was this giant spider in the corner of the shower. And she goes, I was good for like 2 minutes, just staring at it, trying to get ready, right, and shower. And then she was like, and then I had to run out because I couldn't handle it anymore. She hit her length of duration, like where she was like, I can't do it anymore.
That's me.
The longer you're near the thing, the less we can handle it. So,
oh, it's so funny. I got this. I don't got this.
Yeah. And this is the same for dogs, right? So I would really focus on the desensitization if you can, but counter conditioning, both fireworks, people being in crowds, and then really on 4th of July, especially safe space. Try to create just like a padded room where they can't hear the noise, and they can feel safe working on a chew. They're not in a room with a bunch of visitors if you're having lots of friends and family, and that makes them a little bit more anxious. having them in a safe space where they can just settle and be alone might be a good option. So that's what I would focus on. But same kind of protocols as you go. Anne has a good question. Pull it up here. What can make a dog suddenly anxious about a loud sound when they never were before? As a puppy, our dog was fine with it, but as he got more senior and older, it became an issue. So it really depends on the dog, and it depends on the sound. So startling is normal, right? It's a normal response to a loud sound out of nowhere. And the recovery is what's changed in that example. So it could be something like with Bit's question of, was there something else that got associated that made that more negative in that moment? And then that feeds future negative reactions and anxiety and fear. Could just be a louder sound that they're like, wow, holy cow, right? Like, that's way scarier than anything I've heard before. I've noticed too with Suki, she's gotten more anxious with thunder and fireworks as she's gotten older. So, and I don't know, Stephanie, is there anything?
I was wondering, I was trying to think about this too. Could it have anything to do with hearing as they get older as well? Like, I know when we were talking about our senior dogs, the last time we did something like this, that, you know, we were saying how older dogs can get startled because they can't hear. Could it have anything to do with, you know, it kind of makes sense, but kind of doesn't as well, that are they startled more because although their hearing is worse, so you would think that they can't hear them. I'm just trying to think.
Their other senses maybe are heightened. Like,
yeah, I'm trying to think this out as I'm going. I'm just trying to, like, you know, are there other senses heightened? So like the reverberations,
right?
Or does it attenuate the sound a little bit so it comes in differently? It's just an interesting thought to me that as they're becoming more senior, that it is fearing them more, because I'm trying to think of my senior dog too. She never had a problem with thunderstorms, you know, to the point where my mom thought she was deaf during her first, like, really bad thunderstorm.
Yeah.
And she played a trick on her, and she, like, whispered her name during the thunderstorm, and she's fast asleep, you know, out cold, on her side, snoring, whatever. And we're watching this amazing tropical thunderstorm in Australia, and instant head was up, and she was like, "What?"
You said,
like, yeah. And but as she got older, same thing, just like thunderstorms, she was just like, she wasn't such a fan of anymore. Yeah. So I wonder if it has something to do with, like, the senses, you know, they have their whiskers. Has it got something to do with, like, is everything just a little bit more in tune to it? So maybe not necessarily a hearing thing versus an everything else thing, you know, everything else changes. The pressure changes.
Yeah. And I definitely could see that. And then maybe it's also, you know, as they get older, canine cognitive dysfunction. So the brain quite is like, wait, what is that? Right.
Yeah.
I don't remember what to do now.
Yeah.
The other thing I think of is sensitization. So over time, it just, they were stressed, but not so obviously stressed, but then it kept stacking. And then finally they just were like, nope, too much.
Yeah.
Right?
Older dogs just become a little bit anxious as they get older anyway, because it's just a generalized anxiety. You know, their joints start to hurt. They maybe get a little bit attached to their person. You know, it's just things that just get a generalized anxiety. It's kind of like people. It's a little bit more anxious as we get older. Like, I don't want to be around crowds anymore. I'm good.
Oh my gosh. Yeah. So there could be a lot of reasons why. Why it happens. It'd be interesting to really dive into that deeper.
Yeah, that was a really good question. Yeah, I would like to know.
Yeah, me too. I'll have to dig.
We should probably ask a veterinarian and a behaviorist that.
We should. I'll find some. Mary had some other questions that were really good that she sent in ahead of time too. And one that you and I were actually talking about before we started this live was, can fear of fireworks be eliminated permanently, or is effectively coping the realistic end goal? So I think that this depends on when you start desensitize, like when you start thinking about this for dogs. So it depends on what kind of prep work, socialization, proactive exposure work you do. It depends on the level of anxiety a dog has with noise phobia to begin with. So when we're making prognoses, I don't know the plural of that word.
You're right.
When we're thinking about that for a behavior case, we're taking into account so many things for that individual dog that it really does depend. So I could eliminate permanently noise phobia for fireworks in particular. Like, I wouldn't even want to say all noise phobia because there's so many different kinds of noise that a dog could be phobic of. Vacuums, hair dryers, thunderstorms, fireworks, cars. There's a lot. The alarm on your phone. I had one client whose dog heard the Apple phone alarm and was like, ah! Would like run away. So you can do a lot of proactive exposure to really minimize the event of any noise phobia in the future with that noise. So when you start really young with puppies, getting them used to fireworks, you can prevent phobia. I wouldn't say you can prevent noticing or alerting to those kinds of noises, but if they've been desensitized, they have really good recovery and resiliency in those kinds of situations. So does that count as eliminated? Possibly, right?
Yeah.
But that's more of the pre stuff, like you're prepping for that, you're preventing stuff. Versus if I start with a dog who has noise anxiety, noise phobia, and it's a high level, it's a high intensity anxiety, or reactions to it are really intense, then I might change my expectations to that. Let's help them get to a place where they can cope, where their recovery time is much faster, where they're not getting as anxious as quickly. So incorporating the management techniques, right? Noise masking, safe space, medications maybe if I need, or supplements, adapt, whatever. So the management of it to make it less intense for the dog, but then really focusing on desensitization and counter conditioning to get them feeling better all around, because that's really the only treatment plan for it, right? Medication can help bring it down and help control it, even to the point of where it's so low that behavior modification doesn't make sense in that case because they're doing so well with just medication. Right. But if I have an intense case and it's like, well, let's at least get them to the point where they have a good routine, they learn how to cope with this. And then hopefully over time, let's see how far we can get with it. But I never would expect that dog to not notice a loud noise like fireworks. And I personally would never stop being like, yeah, it was a firework chicken. Right. For any dog, like even my younger dog who doesn't care that much about fireworks right now, I'm still going to counter condition it when it happens in real time, because I don't want him to all of a sudden develop it, right? Like Anne's question, like all of a sudden that one noise. So if I can at least be prepared to do as much as I can to prevent that. So it's a good question, because it definitely depends on what the definition is for eliminate completely. And then I think coping is the best thing to aim for with my clients. I'm like, let's help your dog feel better, because that's what we care about. We don't want to see our dogs in distress or our cats in distress. And so at least let's help them learn how to cope. And then if we can even get beyond that, awesome. But let's start there. And I think that it's doable. And then once we get that, my clients are so much more committed to the training when they see that progress, that then they're like, okay, let's find the next step that we can work towards and stay successful with this. Yeah. So I don't know if that answered your question completely.
Yeah. And I mean, I think, like we were talking about, because I asked you the same question. I was like, I honestly don't know the answer. I defer to you on that. Like, can it be cured? And, the answer for people, I would suppose, is that I don't know if these things, I just put my hand up in dog fur whenever just look at it floating. I don't, the life of dog owners. I don't know if for people, if it's cured so much as it is controlled or managed, right? So I think that's basically what you're saying. It becomes manageable, and then I don't know if it goes away so much as it's just managed, and maybe it gets to the point where it's managed on no medications and no supplements or anything, and then is that at the point where it's gone? Maybe, Maybe.
Right? Or it's managed to the point where the brain creates a different pathway for itself as a response to that stimulus.
Exactly. And I think exactly. It's probably the same for people. Like one day, someone who has anxiety may never need medications again, but maybe at some point in the future they might.
That's a good question for
exactly.
We need like a human psychiatrist to join us because now I have questions.
Exactly. Because, at the end of the day, as I'm sure everyone is aware that, they're saying that anxiety is actually a chemical, or anxiety and depression is a chemical imbalance in the brain. So yeah, very interesting question from Mary. And yeah, one that we still have lots to learn on in dogs and cats. So
yeah, because we were talking about on the human side with the fear of spiders. It's like, well, okay, if I go and get treatment for arachnophobia, like extreme arachnophobia, it really is just training the brain what to do, and you have to consciously do it over and over and over again to the point where it's almost an unconscious response when you do see that thing. And does that count as cured? Or like that's where I'm with you, where I'm like, I want to learn more about that. Like what counts as cured for anxiety? Because you could argue that a lot of different ways.
Yeah, exactly.
Interesting stuff. Let's see. Oh, Mark has another question. Let's see. Oh, this is good. This is a good question. How do you keep one fearful dog from influencing negatively our other dog who doesn't really care about the sounds, or the other way around? So how can one help the other to be less fearful? It's a great question. Yeah, and I think it always depends on the dogs and the dynamic and kind of temperament of each dog. I do like having a really mellow, chill dog, like the decoy dog in situations for different things, because there is mimicry and there is that like, okay, well, they're not freaking out, so maybe I shouldn't freak out, right? And so you're kind of hoping that transfers in a good way. But a lot of times it flips and goes the other way, and I see this a lot with barking, where a second dog joins the house and they're a big barker and they alert bark at everything. And then the other dog, who before did not care, is like, oh, what are we barking at? I'll bark too. And then it creates a new habit, right? So you do want to know your dogs and their temperament. And I don't know if it's Bruce or Caroline that is which one for Mark and Mary on this. But I would do a lot of focusing on the anxious one, right? But not forgetting the more chill one. So you want to counter condition both, really focusing on the anxious one. Like, yeah, good job, Bruce. I'll just use Bruce as an example, right? But Karen, you did amazing too, right? But you want to watch Bruce's, in this scenario's, body language to see if you can see when he's starting to get amped up and redirect at that point, right? And maybe that's where, let's go get a bully stick. Let's go do something because I noticed that you're starting to get a little restless and pacing. Let's go do something else, right? And kind of redirecting their anxious or nervous energy. And the other dog who's like, I was fine, but this is awesome, right? Then they're creating some good counter conditioning too, where it's like, oh, we don't bark at the fireworks anymore. Instead, we go and we have a snuffle mat, right? Or something like that. So you're creating great associations for the less anxious dog, while the more anxious dog is still getting that counter conditioning and focused practice on with. So you're kind of preventing one from feeding into the other by trying to get it before it starts. Does that make sense?
Yeah, that makes total sense. Yeah.
Other option, I wouldn't really do this really myself. It depends. So if the second dog, less anxious to begin with dog, does spin up really, really high because they're seeing the other dog spin up really, really high, I would consider separate safe spaces. But it depends, because then does that make them both more anxious not having each other, or does it actually help them calm down? And this is where you'd really want to know the dogs you're with and how you're working with, because it's really about finding the setup and the management that helps them calm down. And if that means not being with the other anxious one, that could be a good choice. But again, I'd really want to weigh but does that make them more anxious if they're separated? Like Fozzie Bear, if I had him in a separate room with Dad, right, during the fireworks, and then I was with Suki in the other room, he'd be more anxious, partly because of Suki, right, more because of me, because I'm not there. So you want to kind of weigh those aspects of it and figure out, okay, what works best for both of them in this stressful environment to not feed each other that anxiety.
Yeah, right. Yeah, that makes sense.
Oh, and then Mary's last question that she sent in, are there any calming supplements or prescriptions that actually work? Which is a great question. We talked about it at the beginning. I definitely ask your vet about Cilio. I think especially if it's noise event based, I've heard great things from my clients who've talked to their vets about it and started them on it. It's not a long-term thing, so you can use it as you need it, as your dog needs it. But yeah, and check out the link that we shared that has the medications and supplements that Stephanie was talking about. But it really is a conversation with your vet, and then trial the medication.
Trial. Yes. And always be there when you're trialing. I don't know if people realize that. A trial doesn't mean give the medication and leave. Like, you have to be there with them. And yeah, I know it's funny. Surprisingly, also people do, and this is no joke, people come to vet appointments without their pet. That has actually happened. And I'm not sure why, but yeah, that has happened. So
the brain has affected us all, though.
Yeah, it really has. So yeah, I think just understand that like a trial means you need to be there. And, you know, the reason why, I'll use an example. Someone gave trazodone, that sedative, to their dog per the prescribed amount, normal dosing, and also was given gabapentin. So trazodone and gabapentin are often given together for super anxious dogs, flying, or, whatever it is. It's a nice combination. Some doctors will use it together. And so it was like, give trazodone. If that's not enough, give the gabapentin too. And they used the trazodone, and again, were advised to be there for the trial. Called an absolute panic. This dog was out cold. They thought it was having trouble breathing. It couldn't even stand. And so, of course, my recommendation was bring the dog in, like pick it up, put it in an Uber, come on in. It's New York City, so no one has cars. So that's the Uber reference. And the good news is, by the time, they sort of got the dog up and ordered an Uber and whatever, the dog seemed to be doing better. But this is why you need to be there, because if you'd given the dog the trazodone and then left, that dog could have fallen asleep in its water bowl, tripped down the stairs, any of those things. And this was the regular amount calculated for this dog's weight. So it was no fault of, the prescribing doctor. It just, that's how it affected this dog.
Yeah, and every dog's an individual. Metabolism, all that stuff. Yeah, so the trial and being there, watching, noting any changes, that then you can ask your vet, like, is that normal? I was a little worried about it, or it make a difference. So, what do we do next? Yeah, you want to be there, take notes, little video clips.
Video clips work, diaries, etc. So of course we went down on the dose of trazodone, and the dog did not need gabapentin. So just always be there, for any trial you are going to do of anything, be it a medication or a calming supplement. Just have no idea how it's going to affect your dog. Okay.
Is there any medications that you really would recommend people totally avoiding?
I think, one we haven't touched base on, and one that, used to be something that people probably heard of a lot, is something called acepromazine, or people referred to it as ACE. So that used to be the drug of choice before all these other medications came out. And the reason that we just don't use it anymore, I don't even know if we have it in the hospital anymore. I think we have it as an injectable if we need it for literally tranquilization. The reason we don't use it is because it literally does that. It is a tranquilizer, and that is all. And what a tranquilizer is it quite literally just stuns you. So
but the brain, it's just the muscles.
Yeah, so it stuns the muscle. So it is used as for a better reference, it is used in dart guns. So when people are trying to dart wild animals, so the last time I saw it used, and people get a laugh out of this, is on a kangaroo farm. to dart wild kangaroos to be relocated. And we're talking the big boys, the ones that everyone posts on Facebook, like in Australia, and they post those big kangaroos with like jacked muscles. They actually exist, first of all. And second of all, they are scary. And so they dart them, and they literally, it shoots out the little dart with drugs in it, and it quite literally just tranquilizes them. And so I think there's a good reference in the article, or I know there is a good reference in the article that I wrote, of what it would feel like. And basically it feels like someone is just restraining you. Your muscles go basically flaccid, and you are 100% aware of everything that's going on. You can't do anything about it. You can't do anything, but you can't move your muscles. You can't speak. You can't blink your eyelids. You can just so imagine if you're going in for a dental procedure, you can feel everything. You can see everything. You can't do anything about it. That is what acepromazine does. So the reason they do this to animals to move them, or fractious cats, etc., is so obviously people can't get scratched and things like that. But do you think it lessens the fear? Absolutely not.
It's got to increase it. That's like that major sensitizing moment where it's like, this is awful and I can't do anything. Next time I hear the sound of fireworks, like super fear, like hits you.
Hey, here's that fireworks that you're really afraid of. So it's still going to go off, but you can't do anything about it.
Yeah. I'm so glad there's better things out there now.
Yeah, exactly.
And having those new things come out. Is
exactly. And again, whenever we use it in veterinary medicine, we'll use it to stop that animal from trying to kill us and then use something else. So again, they'll use it in a dart gun. They'll tranquilize the animal and then use something to switch their brain off for that time being. So like a fearful kangaroo in the wild, or fearful wild horse, etc., whatever it is. So now they've stopped running, they've stopped moving. Fearful cat in the clinic that has escaped. You'll be surprised how many times that happens. We give them ACE, and then we'll follow it up with something that then turns the lights out essentially for a period of time. So we're not restraining them that way where they can tell everything is going on. We would never do that.
So it's used in combination now.
It's used in combination nowadays, whereas it wasn't previously because they didn't know at the time that that's all it did. So we used to, and when I say we, I mean, obviously my colleagues previous to me becoming a veterinarian, we used to give out acepromazine as tablets, being like, this is great. Look at this dog. It's not moving. It's amazing. But didn't know that the lights were still on upstairs, so these poor dogs are not moving. Meanwhile, their poor eyes are flicking back and forward going like, I can hear and see everything.
Now we know better, right? That's I love that we know better and there are better options.
So again, if your doctor prescribes acepromazine, just be like,
let's talk about this.
Can we talk about this? Yeah, exactly. And it may just be that they just aren't aware. They may be an older generation veterinarian, whatever it is, So
awesome. Well, I don't see any newer questions in the comments, but if anyone has any questions watching this later or thinks of something later as they're desensitizing their dog, counter conditioning their dog, you can always come back, pop a comment in, or email me at training@preventivevet.com if you have any questions. Thank you for joining us. Great questions that we got. And thank you, Dr. Stephanie, for joining me today to talk about fly.
Always fun.
Everyone has a safe 4th, hunkered down with their pets, like I will be doing.
Yes, me too. Practice your pets, put their collars on.
All the things.
All the things. Go see your vet. Get your meds if you need them. If you don't, lucky you.
I know, right? Awesome. Thanks, everyone. Have a great
day.